As the coronavirus pandemic took the world by storm, for the first time, many people in developed countries understood what it is like to lack access to essential medicine they need to survive. For people in poor countries, lack of access to medicines has always been a problem. This podcast explores the access to medicine issue and how we can promote global health more broadly. Famous scientist Marie Curie once said, "Talking is the best medicine." In this podcast, we will heed the advice of Curie and discuss how we can ethically and effectively tackle the health challenges currently affecting our world. Throughout this series, we will break down and explore fascinating new research being conducted by leading researchers and activists in the diverse field of public health who've dedicated their lives to understanding the problems and identifying the solutions to health crises that impact millions of people around the world. So sit back and enjoy this episode of Talk is the Best Medicine, brought to you by Global Health Impact Project in partnership with PlankSip.
In this episode, we're discussing the global response to the COVID-19 pandemic, embodied in the Access to COVID-19 Tools Accelerator, or ACTA. It has been now a year since the ACTA was initiated. How are we doing? The ACTA started in April of 2020 and was groundbreaking. The ACTA started in April of 2020 and was a groundbreaking global collaboration to accelerate development, production, and equitable access to COVID-19 tests, treatments, and vaccines around the world. Using the strength of various partnerships, it has expedited COVID-19 rapid testing, effective treatment, and established the COVAX facility to distribute vaccines. COVAX, which we've discussed in previous episodes, aims to vaccinate the world. But while almost half the world has gotten a COVID-19 shot, the proportion in some poor countries is less than 3%. Today, we're talking to Amanda Banda, who is leading the civil society review of ACTA. What has the international community achieved in fighting the pandemic through the ACTA? Where has it failed? How can we improve the ACTA for the future? These are all questions we're hoping to answer today. Amanda Banda is a Malawian national working in the global context for over 14 years, specialized in global and domestic national health, politics, policy financing, and governance, influencing and engaging with global health institutions, partnerships and private foundations, national government policies, and investments related to health systems, HIV, TB, SRHR, and COVID-19. Currently, she's an expert working in and supporting advocacy initiatives in the global context. EECA, SSA, Asia, Pacific, Latin America regions, and global context experience, mobilized and working with CSOs and communities, as well as building their demand and securing real health access change for populations. Within the Access to COVID-19 Tools Accelerator, ACTA, she is a part of the community-led response workstream and one of the two CSO representatives to the ACTA review process led by the WHO. So, Amanda, thank you for joining us today. Could you tell us a little bit about your background and how you got involved with WEMOS?
Yes, thank you so much, Daniel, for having me. This is such a pleasure. So I'm a global health advocate, basically very much specialized in engaging with global health initiatives and institutions, trying to get the real issues that people are facing on the ground addressed. So yeah, I call myself an advocate, an activist, if you may say. But that's what I've been doing for the past 14 years, engaging with global health initiatives to ensure that real global health needs that populations are facing on the ground are addressed. Thank you.
Right. Okay. That's very interesting, and we're very excited to hear more about your experience. So let's get into the conversation. Can you give us a brief overview of access to COVID-19 Tools Accelerator, or ACTA?
So the ACTA initiative actually is a good idea of an initiative that's been put in place by global health initiatives in response to the COVID-19 pandemic. And I think that the idea of having a large number of global health initiatives, the Global Fund, WHO, UNICEF, UNITAID, Gavi, and many others really pulling together their resources and energy and platforms and, know how to really address the COVID-19 pandemic is a brilliant idea on its own of an initiative. But I think that, of course, a lot of criticisms of the I think, objectives of why this initiative was put together in the first place. I think that people cannot deny its importance and why such an initiative was essential to come. And I think it did come timely and also very much quickly. So the other issues then that we see that are being faced, or like criticism around the ACTA initiative, is about the functionality. I think we'll talk about it in more details in the podcast, but I think that maybe to just put it in summary, the ACTA initiative is an initiative that has been put in place to respond to the timely distribution of vaccines, of tests, of therapy, in response to the COVID-19 pandemic, especially prioritizing low-income countries and those countries that are, at the back of the queue that cannot really afford. And so it's meant to be an initiative that is meant to promote solidarity in response to the COVID-19 pandemic, to make sure that everybody gets access to tools, diagnostics, and therapeutics. I think maybe that's the best summary of putting it. But, bringing together a collection of a number of global health initiatives and the experience in responding to global health.
Yeah, thank you for that. I would tease out from that response. I think what you're saying is that your overall opinion is actually a positive one. Is that the case about ACTA overall?
I think the idea of ACTA, yes, overall opinion, I think is a positive one. I think that we really have to applaud the fact that bringing together a lot of almost the entire global health community, the civil society organizations, governments, the private sector, and global health initiatives into one space to mobilize resources and act in response to the COVID-19 pandemic is such a good idea. And I think that they have managed to bring together people into one platform. So in that sense, yes. But on the other hand, not such a positive rating in terms of how ACTA has functioned, in terms of how also it definitely has not done well in terms of meeting its objectives and also maybe fulfilling its mandate in a way. So there's, on one hand, I think that bringing together a lot of global health initiatives to quickly act in response to the COVID-19 pandemic, I think that's commendable, and mobilizing resources as well, although not enough. But on the other hand, I think we do have to acknowledge that it has challenges and that need to be addressed.
Right. Okay. Well, a review of ACTA suggests that it should continue until 2022, as long as there's a critical need for coordinated support for low and middle income countries. Can you explain what this means in terms of support? And we're curious, at what point would low and middle income countries not need coordinated support for COVID-19? With how supplies are going currently, it seems that low to middle income income countries will always need coordinated support, barring an end to the pandemic?
That's a very good question. I think that beyond 2022, I think that we definitely will need the ACTA initiative and platform beyond 2022, at least given the rate of the way the response is going. So I think we all know of the high imbalances around equity to access to the therapeutics, diagnostics, and just vaccines that exist in the world. And I think at the rate of how things are going, it's not going to be possible not to need ACTA beyond 2022. I think definitely it's something that needs to go beyond, at least up until a point where we can get at least a huge number, and I'm talking about huge number, maybe in the rates of over 80% of people, maybe in the low income countries, able to access diagnostics, vaccines, and therapeutics. But I think at the moment, we're talking about 20% on average. And for a lot of countries, I think that if you single out individual countries, I think that we are talking about 7% of some countries have had their populations vaccinated. And 2022 is too soon to think that we will not need it.
Right. Okay, so another review we read stated that the funding issues are not due to a weakness in institutions comprising Act A, but due to a lack of consensus between political leaders about what Act A should do and fund. What's your opinion on the political implementation?
Sorry, could you just repeat that question again?
The political leaders seem to be not adapting or adopting the Act A primarily because there's some ambiguity around funding and what to do with Act A. Do you have any opinions or thoughts about implementation politically?
Yes, so I think it's fair enough. It's fair enough. I think that there's some sense of ambiguity, and I think that for a lot of countries and governments in high income countries, but also the global health initiatives, this COVID-19 is seen, unfortunately, as temporary, because I think that there's this sense of it's a pandemic. I think we now have tools and diagnostics and therapy. We're going to get over it as soon as possible. But I think we need to learn from the past. I think TB, HIV has taught us that things can get out of control and out of hand pretty much fast. And so maybe I think there's a kind of like uncomfortability around, do we now, we have Act A as a temporary kind of like solution and platform and space to mobilize resources to mitigate, and to respond to COVID-19. But I think that the fear could be that governments and donors may not want to commit to this in the long term. And so I think that's kind of like a sense of uncomfortability in terms of commitment and kind of like also direction. And I think that's why we have this initiative that's good on paper. I think it's trying its best, obviously, but it's still far from actually reaching its goals and its mandate. And at the same time, you have the donors and all the other actors that are putting resources in that also, maybe stuck with a bit of fear, like, for how long is this going to be? Are we not going to get stuck with another initiative that's going to be present in the next 20 years? I mean, think about the US when PEPFAR was formed. I guess that they must have thought this is just a 5-year initiative, but 20 years down the line almost, I think we're still here. And I think same story with Global Fund. And so there is valid fears that maybe this could be that like the long-term initiative, and do we want to commit to it or not? And so for me, I think it makes a lot of sense, but I think that the lack of also decisiveness and really rapid response and effort that needs to happen, to make sure that we don't get this COVID pandemic to become, an epidemic and to become a long-term thing. I think that political will and action and push and will actually is lacking. So you have on one hand the fear to invest and maybe the fear of being stuck with an initiative that could earn up a long-term thing. But at the same time, also a lack of action, a lack of will to do what needs to be done now to avoid that situation. Because I think that if we have the investments done now, we could easily avert that situation. And I think just drawing back from previous pandemics, I think we have learned that it can actually get to become a long-term epidemic if we're not handling it properly.
Excellent. Okay, I'd like to go back to TB just for a minute, and hopefully we can get a little clarification. ACTA has prided itself on being an unprecedented global partnership. How difficult was this to put together? And are there any lessons we can learn from this in informing other partnerships addressing other diseases such as drug-resistant TB?
So I think it's a tough one to draw parallels because we have to look, first of all, at the context. I think that definitely it required less motivation for ACTA to be put together because the entire world was in a global crisis, was facing a lot of unknowns. And I think that the real threat of what this pandemic do, not just to people's health lives, but I think it's to economies, was very clear, and I think it's still very clear. And it's affecting everyone. It's not just a thing that's impacting people in low-income countries. And so I think that it was fairly easy to get global health initiatives, civil society, governments, and private foundations to put together their heads and their resources and pool and come together to, immediately respond to this. I think that the problem with TB is that it's not, unfortunately, I don't know whether I should use the word unfortunately, but it's not a burden in high income countries. And so the response, the level of work that needs to take place to convince high-income countries and global health initiatives that also this is a huge threat to people's lives and it needs equal attention. I think that is not the same. And I think same questions that I think a lot of people have been asking. We've had TB as a huge killer, almost top killer of people in the world, but where is the vaccine? Where is, the level of innovation in technology and response? I think we've had HIV for a long time. Where is the vaccine? Where is, so I think that for COVID-19 and ACTA, I would say it's different because we are responding to something that affects both high income and low income countries are not exclusive. And I think that the level of interest is high in that sense, although there's challenges and there's problems as well.
Right. Okay. I'd like to bring up COVAX. And for listeners, it's the vaccine distribution arm of ACTA. It has been scrutinized for not meeting its goals. Were these goals set too high from the outset, in your opinion?
So I think, in my opinion, no, the goals were not set too high. Actually, the goals were very low because I think that if you look at the original goals, if I'm not mistaken, I think was looking around 40% of the population. And I think that's not very ambitious. Of course, one can argue that, well, a lot of unknowns and we know also it's taken a lot of time, of course, to develop vaccines, and delivery of vaccines is also not an easy task. But I think, in my opinion, that the targets were very low. And despite the targets being very low, also that the performance has been not good. It hasn't performed. I think that it could be better. It could be better because, like I said earlier on, we're talking about still less than 20% of the population in low-income countries have been vaccinated. And if you look at it country level, I think it's the lot of data and statistics I'm looking at is looking at 7%, 10% of the population has been vaccinated. And on average, although not much more than 20%. And I think that's a reflection of the low ambitions that the COVAX pillar set.
Okay. On the WHO website, it claims that the ACTA is not a charity, but an investment. An investment of $50 billion US can give a return of $9 trillion US by 2025, since the pandemic would end sooner and thus generate a global economic boom. Do you agree with the statement that looking at assisting other countries with diseases should be an investment? Are these numbers accurate, in your opinion?
So I think that I have a bit of a problem, I think, with the terminology, like the investment, and definitely it shouldn't be charity as well. I think we need to be talking about, it's about solidarity. I think that one of the problems that we've had is to get high-income countries to understand that, you will not beat the pandemic if you don't fully vaccinate everyone. Like we just saw, I think, this past week with the new, variant. The level of panic, the level of, just shutting down countries. For me, it's a clear reflection that I think we have not yet understood that it's solidarity. It's a public. It's about public good. It's about let's do this together. To beat this pandemic. To invest, I think, is the wrong way of looking at it, in my opinion, because already it's alluding to, yes, money is important, but I think that it's already alluding to the profiteering or return on investment on something that you're putting down, and not realizing that it's about goodwill, it's about solidarity, it's about ending pandemic, and it's about, when you look at it as an investment, I think you're also looking at it maybe as a problem, a certain part of the world and not another part of the world. But I think that's also forced thinking, because I think COVID has challenged a lot of our thinking and a lot of our assumptions that certain languages then are also doing fast enough along with that. But I would definitely not agree that it should be seen as an investment. I think it should be seen as a public good, as an act of solidarity, as an act of actually almost, I think, really, like it should be seen as not an investment, but it's our responsibility as governments, to ensure that we end this pandemic. And to your question around the numbers there, I think that's also an underestimation of the real needs, because we know that for sure there's certain aspects of the ACTA, even strategic plan, that have not really costed. So for example, speaking about the health systems pillar, which we have argued all along that is the most underfunded. And when you look at the new ACTA strategic plan, I think the numbers that are appearing there are not a true reflection of the needs, because they looked at health systems, for example, as let's provide PPE, to help healthcare workers. But health is much broader than that. There's no numbers there to reflect what are the workforce, what are the needs on, data, policy, and all the other, lens of looking at health system. I think putting it at that specific number is a bit of an underestimation, but maybe also it's a bit of a tactic to not put so much panic in terms of the level of investment that needs to happen to end this pandemic. But I think we need to be able to come out and say, it's possible. We have the tools, we have the vaccines, we have the therapies, and we have the diagnostics. I think it's possible to end this, but let's and those resources should not be seen as an investment, but rather a responsibility of everyone that has money and that doesn't have the little they have. They need to bring it all together in solidarity in this pandemic. Yeah.
Right. That's really good. Okay. Well, we're going to elaborate hopefully a little bit more on some of the highlights you brought up. Many experts, civil society, community leaders are asking for changes that may lie outside the existing parameters of ACTA. With ACTA already in progress, is it possible to make changes outside of the scope of ACTA? And what is that process like?
So, yeah, that's a good question. And I think that's one of the issues that's come out of ACTA review. And I feel like it's very possible to make changes, within the scope of ACTA, because it's not some stone. I think that the very same idea review going on, I think, should also indicate that I think that it's interest to see what's working and what's not working, and how do we change that. Well, I think definitely not out of scope of Act A. I think out of scope for me sounds like not just willing to be flexible, because we don't disrupt the status quo. Things are working because maybe it's also too much effort and much harder to try to see how this can be, can be run. And maybe it's also running on the false assumption that, well, it's only temporary initiative, and so we're going to be done with this pandemic by end of 2022. We might not need this initiative anymore. So why bother to make all the changes? And that kind of line of thing will make one think that it's not possible. But I think that, with I had explained earlier, COVID pandemic, I think, is going to go on for a bit longer, as long as we have vaccine inequity and all the other realities that we're seeing around, the COVID-19 response. And so we have time to make changes. And I think it's just about the political will within the leadership of the ACTA lead agencies to really dive in and think about, what those are. I think maybe it's in my opinion, because some of those changes, I mean, remember that we're looking at ACTA as a platform that's bringing together independent and parallel global health initiatives that have been in the global health for a long time, with quite a lot of experience and also lessons learned, but also not lessons learned. And I think the part of the not lessons learned, maybe they saw things that they perhaps are also faced with within their own independent, separate institutions, that changing it within ACTA will also make people think about, are we doing it right in our own, global health initiative, So I think maybe that's just a matter of lack of maybe willingness, but I think that's possible to change, given that I feel like this is not, it shouldn't be a temporary solution, and it's not going to be, because we still have a lot of people that have not been vaccinated. We still have a lot of that don't have access to diagnostics and, therapy as well.
Yeah. Okay. Let's look at some of the challenges as we look into the future. One issue with fighting COVID-19 globally is that there is a lack of healthcare workers. One report states that over 115,000 healthcare workers have died from COVID-19. This is not including those that have resigned or governments that could not afford to pay them. You've stated that ACTA can help bridge the gap in the short term. Can you go into what this means and how you imagined ACTA assisting with this shortage?
So I think one of the things that was overlooked, especially in the early stages, was the fact that you will need healthcare workers to deliver whatever level of service, whether it's vaccines, whether it's the diagnostics, the testing, whether it's community outreach, information, education. You will need a lot of involvement of healthcare workers. So I think prior to COVID-19 pandemic, WHO gave us statistics that there was a shortage already of about 18 million, a shortfall of about 18 million healthcare workers, and had project need of about 40 million healthcare workers in the next. And so when you look at that and come COVID-19 pandemic, what we saw on the ground, and I think in a lot of facilities for those that are working on the front lines, was that a lot of the health workforce was diverted from their day-to-day work, do the testing, because it's the same healthcare worker that's going to have to go drop malaria work or try to do it at the same time. So you're looking at already far stretched, insufficient health workforce to deliver HIV, TB, malaria, and all the other non-communicable diseases, like response and manage them. And you're speaking about the level of amount of healthcare workers it needs, or the lab works for the multiple disease conditions. Come COVID, I think there was a disruption definitely in the delivery of the other services. So you're looking at already an overstretched health workforce. That's not enough. And you have a pandemic. And yeah, I think that recent reports, I think in HIV, in TB, have shown that there's been drops. And I think even when you look at maternal and child health, when you look at sexual reproductive health, access to SRH service, maternal and child health services, vaccination for under fives, these services have dropped, not just because we've had the COVID-19 pandemic and all the other disruptions that have happened, but for me, in my opinion, and based on what we're seeing on the ground, is that it's the same healthcare worker that had a program to go and vaccinate 1,000 kids that now has to divide her time to diagnose, run tests and do all the other work that needs to be done. So I think it's been an overlook to think that vaccines, as long as we have vaccines, we're sorted. As long as we have, diagnostics, we're sorted, because those vaccines will need somebody to deliver them. Those diagnostic tools would need somebody to run to the lab and run the machines and get the results out to the clients. I think also always drawing back from my experience in HIV, TB, and other programs, health workforce has been always the center that programs, when they realize that we need to also invest in the health workforce, they saw, drastic changes and results. So I think consideration for a surge investment, increased investment in the health workforce, I think that will help move things faster and maybe get those, vaccines out and those tests done much quicker. So certainly there is a case to not overlook investments in the health workforce as we investing in the diagnostics and therapies, because they will need the healthcare workers to do this. But to your point that you raised earlier on, more than 115,000 died, and that's something that nobody's really concerned seriously about in terms of action. I think had been clapping for healthcare workers. We put them on the front page of the Time magazine, but they're still dying and there's still shortages. They're burnt out. I think you will not get immediate statistics at the moment of how many have left actually the professions and given up altogether. Like, it's been a passion to be in the health workforce, but I just can't do this anymore. I think we have a lot of that has not yet been documented. And so it's a priority. And I think, in my opinion, definitely the COVID-19 response and also future pandemic preparedness should happen without real consideration of what are we doing about the health workforce,
Yeah. Yeah. Let's go on and talk a little bit about funding. Funding for the ACTA is going to be critical with 16 billion US dollar deficit and a recommended 20 billion US dollar proposed budget for the next 12 months. What can we do to help fund the ACTA?
So I think that it's it's about I'm failing to answer that question because I always feel like shouldn't it be like a reflect, resources need to be put in this. Like in pandemic, I think it's shown the amount of devastation on deaths, like the amount of people that have died as of to date, and the impact on the economy and on livelihood, on everything else. I think for me, I struggle with, what do we really need to do? And I think the question on investment in health overall is seen as social that just sucks in money and not really actually return on investment. And that's why I also disagree with the language on, it's an investment. This is like a return on investment. It's a right, health should be a right. And as a result, I think that we should be able to put resources and prioritize health in the same way that a lot of military spending, for example, in the same way that they prioritize, other sectors at the same time. So what should we do? I think just a matter of, getting our governments, especially, and I think it's also, we're not also trying to make it seem like it's a responsibility of only, countries in the high income, kind of like, space to support and respond to COVID. I think that we also have seen low income countries trying as much as possible also to put resources and invest. And so it's a shared responsibility. Both high income and low income countries need to come together and put public resources on health in general and invest in the COVID-19 pandemic. I think it should be seen as a priority. I think it's a matter of what can we do. I think it's raising that awareness and pushing for that political will that will put health and COVID-19 response on the same level of agenda that we have. We know governments are spending money on sometimes questionable, tensions, and yet this is a real global threat. And if not managed, I think the extent that it's a real global threat is the level of, for me, how quick governments made decisions to ban and travel and all this. It's a high priority. It's a security issue. But are more willing to put more money in military spending, in other investments that need money, yes, but maybe not to that level of the amount of money that we're putting. I think the amount of money that's needed to invest in health broadly, I think is just a fraction of how much governments are spending in other, interventions that make money, honestly. So
Right.
what
Okay.
can we do? I think it's about wake up that political will and realization and priorities and thinking that our governments have.
Mhm, mhm. Okay, so rapid testing and treatment of disease is very important. In a review, it was stated that delays in antiviral treatment for HIV and AIDS led to millions of deaths in Africa, in the African regions. Certain people are pushing for ACTA to adopt a test and treat type approach, which would theoretically drive down the cost of diagnostics. How could this approach work? And what lessons in treating AIDS, HIV, can we apply to the suggested way of dealing with COVID-19?
So I think that's a brilliant strategy, and I think it's coming from really learning our lessons from other previous pandemics and now epidemics that you can treat. Like if you're going to the COVID-19 pandemic, I think that's the reasonable. And I think science is also showing us that it's just the best approach to take. I think that from experiences in HIV, TB, if you're not going to fast enough and treat people fast enough and vaccinate people fast enough, I think that we have seen the resistance of the virus. We're seeing this in COVID-19. The virus coming out at an alarming level, and I think this is expected, and I think we should expect more and more of this if we don't scale up vaccination, testing, and treating. And level of the spread of new infections, I think, is going to be worrisome. And I think these are also lessons in HIV, TB, that if you don't test and treat, you're going to get more people infected and getting sick and becoming even more difficult to manage than if you had, prevented this in the first place. And so I think that if you want to avoid scaling up of new infections and just losing control of COVID-19 pandemic in terms of the virus and at what rate it's mutating, I think that it's only reasonable that we push test and treat as fast as possible. And
I think it would be true to say something like the test and treat does actually empower local physicians to do to make more decisions. Is that a fair statement to say?
I think that test and treat also works, like where you have also enough, diagnostics, and where you also have enough therapeutic. In the case of COVID-19, I think also where you have vaccinations. And I look at it not just as a model line to say, okay, as soon as somebody tests, we are providing treatment. The treatment is available. And I think to your point that perhaps on the physicians and on the frontline healthcare workers to make quick decisions on how they will manage the patients and their clients. But I think for me, it also speaks to the broader systematic issue. I think it's a policy that also speaks to other systematic issues, because it helps to just have a test and treat policy and empower the physician to take those decisions where they're there, where diagnostics are not there and where the vaccines are not there. You should look at it also like in the broad sense that at the point of care, the point of interaction between the patient and the physician, but also broadly, what are the barriers? What are the systematic barriers? What are the pricing barriers? What are the access barriers? What are the availability barriers that exist, to ensuring that test and treat is enabled and it happens? And I think that we've had test and treat guidelines on HIV from WHO, but in the absence of diagnostics, tools, and therapies, it doesn't work because there's nothing to do the test and treat. So I think for me, it's brilliant policy recommendation, and I think it's a brilliant approach to take. But we need to look at it in the broader systematic lens as well, that it also entails making sure that there's no barriers to access of the tools, of the diagnostics, and of the therapeutics as well.
It just needs a strong infrastructure and support for the workers and the people on the ground. Okay, this is my last question, and then we'll get into some student questions. The review states that ACTA should only exist while the acute need is present. This seems like a program that should continue for many diseases, though. What would be holding back a similar program for, say, drug-resistant TB? Is it the cost and funding? Because of how progressive this program is, the government or the global collaboration aspect seems extremely valuable to continue regardless of COVID. Is there an argument not to continue collaboration on this scale beside funding issues?
So besides funding issues, for me, I think it's about at what point, I think I mentioned this earlier, I alluded to this earlier, at what point are we going to say that this, and do we realistically see that happening in the next 12 months? I think my response is no, because why am I so confident that it's not going to happen? Is because despite the vaccines availability, despite the diagnostics and the therapies that are still developing and that are available, the biggest issues, like for example, when you look at the trip waiver, there's still a lot of pushback, on the technology transfer and the IP. These are real issues, that are really, really access, to vaccines. I think one of the examples that I always give, especially in the early days and even up to this date, a lot of countries, some countries have had money and capacity to purchase the vaccines and the tests, but countries have struggled sometimes. 3 months they cannot access the diagnostics and vaccines. Even though you have the money, you're thrown at the back of the queue because the high income countries have already bought out all the available, and none available still in the pipeline, still coming, vaccinations. So I think it's beyond money. I think it's about at what point. I think for me, it goes to the political will and the global solidarity that needs to be there. Like the realization that we're in this together. Like you will not escape just because you have the funding for it. I think COVID-19 has challenged those assumptions that just because the funding is available, like when I look at the current statistics right now, even as of this week, I'm really worried about the numbers that I'm seeing in Europe, other countries, in terms of the infections and at how fast they're moving into perhaps a fourth wave. They've had majority of the populations vaccinated, but we still having this challenge. For me, it's not just about money; it's about understanding that this is health, this is a pandemic, this is a virus. You're not going to put politics into a virus. It has a natural mind of its own, and so you really need to put politics into a virus because it's been surprising us. And I think that it will continue to surprise us if we stick to the politics that we're sticking to. And I think that's what's delaying us. And so long term, definitely, I think as long as these politics continue to play out the way they are, I think that this is going to be a long term thing. And I think that they will also probably regret 2-3 years down the line, like we should have done this earlier. We could have stopped this, at the point where, before it reached this stage, and we could have resources, we could have put more investment. But what I'm seeing is we want to put resources. There's a bit of resources, yes, I want to acknowledge, that are flowing through the ACTA. But at the same time, it's like a vicious cycle. We are putting resources, but not enough. And we are also then withholding on other essential elements that actually are important to ensure that everyone everywhere actually gets access to, vaccines, tests, and therapy.
Okay. All right. Well, at this point, we'd like to ask some questions that were submitted beforehand by the audience. So just so that we can get through as many questions as possible, and there are 6 of them, by the way, we'll try and keep the answers a little bit shorter. So here's the first of 6 student questions. First one is, strengthening a country's capacity for uptake is important for the distribution of COVID-19 tools by the ACTA. Can you tell us about a specific example of ACTA's success in the improvement of a country's uptake in order to improve COVID-19 tool distribution?
So I think that's a very good question. I would say that maybe that's something that ACTA, especially through the now revamped health and response pillar, they're really trying hard to do this at the moment. I think also that's something that as civil society we have criticized the health systems and response pillar in terms of responsive ACTA has been to the country needs and the demands. And I think that we're seeing has been taken into account, and there's a lot of discussions around how do we ensure that we have a country responsive, ACTA. I do not have the best example of here's where it's worked. Honestly, I think it's all work in progress. And I think that I want to acknowledge indeed that there is work going on within the health systems and response connector to really ensure that they are really responding to the real time country needs. But I think that in a lot of countries, I think that it's still a challenge progress that both ACTA agencies, I think, are trying their best to manage, but we have a lot of gaps and challenges at the moment still.
Okay. All right. So the next question is, how can ACTA incentivize donations and funding to countries that require greater aid for tool acquisition?
So I think that there's a lot of political leverage, within ACTA. I think that this is also one of the things that we have maybe been critical of, but also recognizing that actually this is an opportunity that that political leverage that ACTA agencies, and I think as an initiative have not capitalized on enough. I think that it's enough to put our needs, and here's the demands, and here's how much vaccines we need, and here's how much money it's going to cost. But I think they, as much as they've tried to do that to some extent, I think they've also neglected on the political capital that ACTA has. One case of an example, how has ACTA negotiated on the technology transfer and used its leverage to say, we really need this to happen, and really pushed on the forefront. I think there are, of course, gaps around maybe why that also has happened. And so I just think that ACTA could have better used its political leverage, to negotiate, and it still has that leverage, but it's just not using it, for the reasons that we know, and for the reasons that we don't know. But I think that they just haven't maximized on that political leverage that they have to really, really push the stakeholders and governments and the private sector specifically. I think it's still because of the setup and the structure of the initiative itself, private foundations and sector also as part of it, become very difficult for them to really, really put the public interest and public health of populations first before money.
Okay. All right. How can ACTA help accommodate gaps in education about COVID-19 testing and vaccinations, as many people do not believe in the effectiveness of COVID-19 vaccines or even believe they are harmful?
So that's a good question. And I think that's one of the things that we also have seen being used as an argument of why perhaps we shouldn't also focus a lot of investment because of the vaccine hesitation that it's been a problem. And I think that it's not just low income countries, because the ACTA initiative was meant to respond primarily to the gaps in low income countries. And of course, the issue of infodemic is not just countries. I think that high income countries have suffered. And I think that's where also a lot of this information is coming from. And unfortunately, people have rapid access to media forms that they can access all this information. It's filtered through. And unfortunately, to the point that I raised earlier, it's not just about let's get so many numbers of vaccines out and so many numbers of tests done. I think this is where investment in a holistic health systems is needed. And that's where you will need to invest, like I said, in healthcare workers to do education. You will need to invest in a lot of community engagement, community system strengthening and engagement and empowerment to make sure that populations are well informed. They have the right knowledge and information to make informed decisions. And so what has been happening is that for example, the COVAX pillar would just put in, here's vaccines out, we're done. And here's PPE and we're done. And here's, so many number of tests and diagnostics or therapeutics, but then they're not looking at this as a holistic thing, that there are so many layers of it, and that will need an equal amount of investment if you really are going to have a real, response, and that it's not just going to be one or the other, but that it needs to be broad in terms of reach and scope, in terms of financing.
Yeah. Okay. All right. With the health systems connector, are people in low-income countries willing to use the PPE provided to them? How would it really be possible to measure the effectiveness of this equipment being sent to these countries without ACTA staff remaining in the region to monitor for extended periods of time?
So I think that for me, I think it's an issue of it's not. I think first of all, maybe just to clarify that it's not ACTA staff in countries doing the monitoring. I think ACTA is a platform and an initiative that's meant to support the response. But it's the countries themselves that are on the forefront, driving the response, that are on the forefront, monitoring and sending out their healthcare workers, to put on those PPEs and to go into those facilities and to interact, with. And so I think that it's rather, how is the health systems and response connector maybe collectively, monitoring and supporting countries to make sure that needs, there is sufficient resources, and I think whether it's technical or whether it's financial, whether it's human, to respond to the COVID-19 pandemic. But I think that it's not about ACTA themselves that are in country doing the monitoring and making sure that people are using them. I think that actually there is a shortage even of PPE in a lot of facilities. I think we know that there is a huge shortage. This is something that's in demand. And I think that PPE also in a lot of countries, this is something that is not just also coming from, somewhere in the global north, but I think that is countries have been able to, immediately at the onset of the COVID-19 pandemic, when there was a clear need that we will need protective, wear, personal, equipment. I think this is something that countries were able to manufacture and do at a go. And remember that I think, at least I'm speaking for the African context and region, is that experience in dealing with, pandemics and epidemics. I mean, the experience from Ebola, the experience from HIV and all these other diseases, I think have given people a lot of expertise, to manage and to respond quickly. So I think it hasn't been an issue of, are people willing to use PPE, but is there sufficient PPE? And I think that is also the similar case. I would argue, are people willing to uptake vaccines, or is there sufficient vaccines that's available? I see those as completely two different things. Yeah.
Right. Okay. Here's another question. 2 of the pillars of the ACT Accelerator are diagnostics and vaccines. Which do you believe is more vital to?
Hey, Dan. Sorry, we got a minute and a half. Can we wrap up and do final message?
Yeah, certainly. Okay. Okay. Well, thank you very much for your time, Amanda. Unfortunately, we are running out of time. But before we go, I'd like you to give us a closing message or a question, perhaps, that you would like to leave the audience with. What would you like the audience to know, or is there anything that individuals can do to help buttress the global COVID response?
Yes, thank you so much, Daniel. So I think that maybe my core message will be, I think that the ACTA initiative has potential to deliver. I think that it has been a good space to mobilize resources and bring together partners into one platform and one space to think, what are we going to do about the COVID-19 pandemic, and how are we going to, ensure access to tools, diagnostics, and therapies. But definitely a lot of gaps and challenges along the way. For me, the key message, I think, is to take the politics out of it. I think that we could potentially move a bit faster, if there was real demonstration of solidarity, because otherwise it sounds like, on one hand, we want to help. On the other hand, we are also the very much stumbling block, to reaching that end goal that we want to achieve. So for me, I think it's about how do people like you and I maybe make it possible. I think it's to engage. I think it's to just show our rage with public opinion, like this is unacceptable, because ultimately, if it's a political problem, if it's a political blockage, which I certainly think that we've put too much politics into the pandemic response. And if we as citizens recognize the power that we have in terms of public opinion and changing the discourse and narrative and influence we have on our politicians and governments, perhaps maybe that could take us to a different direction. Because I wonder, what kind of a world would it look like if every other person on this planet says to their leader, we don't like the way you're responding to the COVID-19 pandemic, and we want you to do X, Y, Z. Would they still stay stuck, in the arguments and in their thinking and in the false promises that they are giving? I don't think so, because they also have interest to protect. And I think for me, it's about, we really need, as individuals, as organizations, as institutions, take this into our also top priority and bring that real solidarity to the response, because ultimately, I think it's about power to the people. I think we're putting too much trust, and we're leaving a lot of important decisions in the hands of the politicians, that I think that may be taking us down a blind path. And I'm very much optimistic that, maybe in the next year or two, we'll be done with this and we move on. The economy will recover and life goes on. But I think that the more of us express the rage and the concern and how unacceptable this is, and that the solutions are there, but we need to put them into practice, I think the sooner the better. I think for me, that's my message, that I think the sooner the better. We join the conversations, we join the discussions, and we put pressure on institutions, on governments that we have access to in one way or another, to ensure that everybody that needs and has to have access to tools and diagnostics on COVID-19 should be able to access them regardless,
Right. Okay. Well, that's perfect. Thank you so much for joining us today.
We hope you enjoyed this episode. To find more of our content or explore the exciting work being done by our parent organization, the Global Health Impact Project, you can check out our website at global-health-impact.org/new in the description below. The Global Health Impact Project hopes to continue to support efforts like this podcast to provide information about and advocate for access to essential medicines. Also follow the Global Health Impact Project's social media pages on Facebook, Twitter, and Instagram. Until next time, don't forget, talking is the best medicine.